new life into the world should be a time of joy and excitement for expectant mothers. But for Black women especially, it could be a matter of life and death due to the growing disparities based solely on race.
In America, Black women die 3 times or more during or soon after childbirth than white women. And we know that it's not biological. Black women are not biologically more inclined to die during or soon after childbirth. It's not that our bodies are built in a different way, it's more social factors.
I'm A.B. Tucker, and this is Ill Will, a 5-part series dedicated to examining and exposing the long history of gross medical mistreatment targeting Black women around the world. The CDC found that the maternal mortality rate for Black women increased nearly 26% since the start of the pandemic, and it is still rising. Now, what's even more perplexing is that these disparities exist across socioeconomic status, geographic region, and education level, indicating that race is undeniably the biggest reason for this injustice.
So it's things like medical racism and sexism, where doctors aren't giving full information about pregnancies and birthing to Black women where they can take control of their own health. They aren't giving them the same kinds of medications. They aren't giving them the same kind of proper care.
Even legendary athlete Serena Williams, worth an estimated $300 million, had a life-threatening experience during childbirth, which she discusses in the HBO series Being Serena.
And I remember I was in the bathroom with my mom and I was just crying and crying, and she was crying. She's like, "You just gotta breathe." And I was like, I can't breathe. And it was just really hard.
It seems like the obstacles for Black women are never ending. From restricted access to prenatal care and support services to biased treatment by healthcare providers.
Physicians do not trust Black women when Black women say, "Hey, I have some spotting," or "Hey, I'm having some dizziness," or "Hey, I'm having some fatigue," that their doctors don't believe them, and then they don't care for them properly, and then that leads to poor outcomes when they're giving birth.
Take April Valentine, a healthy 31-year-old woman who died during labor and will never see her baby girl Anaya grow up.
Her pregnancy was great. Like, she had no problems. It was really wonderful.
While at the hospital, April complained that she was experiencing pain. But even as she insisted that something wasn't right, she was ignored and neglected.
I personally asked for the doctor more than 8 times. I know April asked for the doctor like 8, 9 times. And her sister asked for the doctor about 4 or 5 times. So altogether, we asked for the doctor over like 20, 30 times. So all the nurse will tell us is that they can't call the doctor because the doctor was gonna cuss them out, and they're scared to call the doctor. The doctor get mad if they call her.
April's family protested for justice, and the maternity ward at Centinela Hospital in Inglewood, California, where April lost her life, was ultimately shut down. They also sued her attending physician, Dr. Gwen Allen, for wrongful death. However, Dr. Allen was not disciplined by any medical board. No criminal charges were filed against her, and she's still practicing medicine and seeing unsuspecting patients today.
My daughter was a brilliant scientist. She was an epidemiologist at the Centers for Disease Control, had dual PhDs, 2 master's degrees, a lieutenant commander in the U.S. Public Health Service. Yet and still, this brilliant woman fell victim to the same kinds of inequities that she fought so hard to eliminate.
Maternal health advocate Wanda Irving lost her daughter, Dr. Shalon Irving, in 2017, 3 weeks after giving birth.
She was the light of my life. She was just my rock. She was an amazing woman, and she knew there was something wrong, and she tried desperately to get a doctor to listen to her and to believe her.
Dr. Irving's complaints about dizziness and swollen limbs were repeatedly disregarded. While at home, she collapsed and died from complications of high blood pressure.
I don't want my daughter's death to be in vain, and I don't want another grandmother like myself to suffer, or a child like my granddaughter who has to grow up without her mother.
Calls to action are finally happening on a national scale. The Build Back Better Act was passed in 2021, which allocates over $3 billion in new maternal health funding and requires all states to provide continuous Medicaid coverage for 12 months postpartum.
This is an issue that is not just about health care. It is about treating a woman as a whole human being.
Also in 2021, a bill was introduced called the Black Maternal Momnibus Act to improve maternal health among racial and ethnic groups and other vulnerable populations. The bill was reintroduced to Congress in May of 2023, but has yet to pass.
I'm hoping to see a more equitable world. My daughter had a philosophy that she used in life as well as in her work, and that was, I see inequity wherever it exists. I'm not afraid to call it by name, and I work hard to eliminate it. I vow to create a better earth. She wasn't able to do that herself physically, but through her, we are living that legacy.
Exposure and awareness is just the first step to overcoming this crisis, and we will continue to do just that. This is Ill Will, an examination of the gross medical mistreatment of Black women and how this history shaped the healthcare crisis that we are still facing today.